Hi, ladies.
Hey, Cara.
I think I figured this out now. I'm so excited about that. Anyway, happy Thursday.
Happy Thursday. Uh-oh, we lost somebody. Happy Thursday.
I know. She'll be back. This is the first time that we've skipped a week. So we're going to be on every other week for those who have been out there with us watching Good Girlfriends. Now that the world has opened up, we have found that all of our schedules too have gotten crazy. So we're trying to do this every other week, but we have some really great topics coming up. So please tune in, and you can always find us on our YouTube channel. If you haven't checked it out, please go and subscribe and check out all of the wonderful conversations that we've had. So we're just going to jump in tonight to discuss a very important topic. It's not just important in October, but it seems to get a lot of focus in October. But we're going to talk about breast cancer awareness. And we have some special guests tonight, some that will be popping in a little later too. But we'll get started. I'm Cara Dunston. I'm always so blessed to be with my good girlfriends. It just excites me so much. I get really excited to see you all. So I'm going to turn it over to Juanita.
Hello, happy Friday.
I forgot to mention, you all look so beautiful in your pink.
Yeah. Happy Friday Eve. I'm Juanita, AKA Q. Good to be back. I have been missing the ladies. I know the summer we needed a little break from the regime, but I have missed you all. But we kept up. We kept up with each other.
Yep. Yeah, even when we're not on live, our good girlfriends check in on each other like good girlfriends do.
That's right.
But we haven't lost touch, even though we may not be on Facebook Live every week. So Marcy.
Hey everybody. I'm Marcia Penn, or Marcy. So I'm grateful to be here once again on this Thursday evening as we talk about breast cancer, and we honor all those who have gone through this process. And tonight I have she is also a good girlfriend. We have not been together long, but it feels like Amira, a long time. She's a good girlfriend. We literally ride together. We literally ride together. We work together as colleagues and as friends, and we are funded by a initiative with the Lazarus Cancer Foundation. She is a nurse practitioner and currently a pre-doctoral student. So she has a wealth of information, and she is indeed a good girlfriend. So Amira Clemens is our special guest for this evening. So welcome, Amira, and thank you for being here with us.
Thank you. I love the love in the room. I'm happy to be here. All right. Do I introduce myself? I think Marcy did a good job. Thank you, Marcy.
We're gonna talk some more. So she has a lot of information. I will say that for the month of October, we have been doing breast cancer, as we call them, health and wellness chats. And our health and wellness chats are all around cancer. And so this month we have been doing health and wellness chats around cancer survivors, caretakers, and family members, because when we talk about cancer, it's not just the person going through, it's not just the survivor and the thriver, it's also the family members and the caregivers. So we have done some great chats, as we call them, health and wellness chats all around cancer. And Amira has led several of those this month. So we're grateful to have her in our team at work, and we're grateful to have her here tonight as a good girlfriend.
Yes, we are. So Jeanette, you want to introduce yourself?
Yes, I was having some technical difficulties. So sorry, everyone. Happy Thursday. I'm so happy to be here with my good girlfriends. Happy to have Amira with us to discuss this very important topic that probably has impacted everyone's life. And so want to say too that it is something that we discuss in relation to women, but having a father that had breast cancer is also a near and dear topic to me as well. And we very rarely talk about how men experience breast cancer also. So as I say, I don't know if you guys gave the disclaimer because I was going through a few things with this laptop, but we are not experts. We are here together sharing information as good girlfriends do, loving on each other. And it's so good to have you all back in our virtual living room.
Yes. And I have to say, I mean, as close as you and I are, I had no idea your father had breast cancer.
Mm-hmm.
Wow. Yeah. So very good point about this is relevant for men as well. You know, it's not just a disease that women have. So thanks for sharing that, Jeanette. So let's just jump in. We will have some special guests later to share their stories, but for now, let's just jump in. I will personally say that I have gotten my mammogram this year. I hope that all my other sister friends that are of age, or I hear that, and this, I'm not an expert, but I have heard from all of the doctors recently this month that if your mother had breast cancer, you should start getting mammograms 10 years prior to whatever age they were diagnosed. So I just encourage everyone to go out and get their mammograms. I will always also say that it is nerve-wracking even for someone who has not been diagnosed with breast cancer to wait for the results every year. So I can only imagine for someone who has been diagnosed with it, because even I'm on edge just every year waiting to make sure that it comes back, you know, with a good report. So, but I still encourage everyone to, all the ladies and you know, whoever else needs to get their mammogram. So, yes.
To add to that, I wanted to say that I haven't gotten mine this year, but I'm getting it, but I want to convince my younger sister to get one with me. She is 46, and I want to take her with me because I know she's never had a mammogram before.
Yeah.
So I wanted to take her with me to get a mammogram, especially after all of this breast. I've been talking, like Marcy said, I've been giving talks on breast cancer and all month. And I feel like it's, you know, it's such a taboo, and some people just, especially us, we wait until we find something or something is abnormal to go get it. So I want us to just get our screenings together so that we can be the trailblazers in the family for screenings for breast cancer.
Mm-hmm. I agree.
I'm ashamed to say that I haven't gotten mine yet this year either. And Advanced Radiology keeps texting me like, you can still get your mammogram safely. Call us up, make an appointment. So I'm going to make my appointment tomorrow for next week.
That's
I
good.
promise. That's going to be my promise. And then I'm going to check in with y'all.
All right.
Well, I do have a question. You guys, Marcy and Amira, you all have been engaged in conversations this month about breast cancer, and I'm sure mammograms come up. And so I haven't gotten mine this year either. I usually go every year. But the last time I went, they said you don't have to go as often. Like, it doesn't have to be an annual thing. Is that true? Is that something that you all have heard?
I did the last time when I went to my nurse practitioner. I think it's every 2 years, depending on what your risk factor is. But you can still get it every year if you want to get it every year. Yeah.
Yeah, I will say that at some point my my insurance didn't cover it every year. Like, it was every other year, but I still went on and paid for it every year. So even though my insurance changed at some point to say it was not every year, I still proactively went on and had a mammogram every year. Except I will say I did not have one in 2020 because of the pandemic. I didn't have one last year, but that was the first time I had not had a mammogram since the age of 40.
Yeah.
We already have a comment here, and it says, got my mammogram this year. Results came back abnormal. Had to have surgery to remove abnormal cells. Results came back that abnormal cells were removed, and praying they never come back. Well, we are praying with you.
Yes.
Rita. We will be praying with you, and you can believe that we will be praying with you. We will be lifting your name up in prayer. We are praying.
Absolutely.
Praying girlfriends. So, yeah.
Amir, when people say abnormal cells, can you talk about that? Like what does that mean? So I think oftentimes for those who, even if you've gone through the journey, each person's journey is different. And then there are some who have never gone through the journey. So when you say abnormal cells, and when you say breast density, and when you say biopsies, oftentimes those words are foreign to many of us.
Mm-hmm. So the breast tissue is made up mostly of fat cells. And sometimes fat cells anywhere on the body, not just with the breast tissue, they can develop, like they can clump together and develop a fatty tumor, which is abnormal, but it's not malignant. So when they take it out, sometimes, especially with us Black women having dense breast tissue, which means thicker breast tissue, sometimes those cells can clump together and form a lipoma, is what it's called, a lipoma. And again, it's abnormal, but not cancer. It's still a tumor, but it's not cancer. Also, what can happen in the breast tissue is those lobes that would normally create milk when a woman gets pregnant, sometimes they can get clogged. They can get clogged when we're breastfeeding or not breastfeeding or never breastfed. And even though it's not cancerous, they're abnormal, so because they're not supposed to be there. So I think when people say abnormal, it doesn't necessarily mean bad. It's just something that's not supposed to be, like something that's not supposed to be there. Doesn't necessarily mean cancer though.
So. Also, I heard Marcy mention this, but yeah. So I have dense breasts, I guess. What's the terminology for that? Whatever that is, it's dense, and that's the harder. It's harder to
fibrocystic.
Yeah, it's harder to locate cancer in that. So that's the other reason why I try to stay on top of mammograms and self-exams and that sort of thing as well.
Mm-hmm.
So I hear that's pretty common.
It is. They call it fibrocystic breast tissue, and if they suspect that their fibrocystic breast tissue, there's some inability to see cancer, they'll do the ultrasounds. That's when they'll do the ultrasound, because the ultrasound will give you a better picture.
Yeah.
So Amir, so let's talk about when we say like examine your breast. I'll talk about my situation in a little bit, but when we talk about examine your, we take baths, we take showers, you're into your body, but what kinds of things should women and men? I mean, I hear Jeanette talk about her dad. And so we think breast cancer, so often we think of women, but it's something that affects men as well. So what kinds of things should we be doing to ensure that we are checking our breasts or staying on top of self?
Hi. Okay, so to answer that, I feel like we should know, like we talked about before, we should know what's normal for us. So you don't know what's abnormal if you're not constantly looking. Like every time you have an opportunity, you're taking a shower, look and see, like even if you don't necessarily do a self breast exam every time, but look and see, like, is it something abnormal with the skin? Is there something abnormal with the shape? Is there something abnormal with the size? Is there something abnormal with the nipple? Is there something, anything abnormal? But we have to pay attention to ourselves to know what normal is, so that abnormal stands out. Because most oftentimes we don't do anything until abnormal is out of control. Like we don't see the little subtle differences or the subtle changes in our breast or any part of our body. Because another thing, and I know this might be way off topic, but it has to do with skin cancer. How many of us look at our back? How many of us know what our backs look like? We don't turn around unless we're doing a selfie. We don't look at our backs. Like, so in order to know what it should look like, what it shouldn't look like, we need to know what it should look like. So we should always be looking to see if something changes, if something is different every day. Good question. Hopefully that answered your question.
Thank you.
So, so we just had another special guest join us, and this is someone near and dear to my heart. She knows how much I love her. This is my good girlfriend, Larissa And I invited Larissa on because Larissa is I think I'm getting this right, a pre-viver. Is that correct, Larissa? So I asked her to come on and share her story with us because I think that this is something that, before Larissa became a pre-viver, I had never even heard of this or wasn't really aware that much about it. So I wanted her to come on and share her story with us as well. I think this affects a lot of people, or could possibly be helpful to a lot of people as well when we're talking about breast cancer awareness. So welcome, Larissa, to our virtual living room.
Thank you. Hello, everyone. I'm so grateful to be here and to be able to share a little bit of my story in hopes that it will inspire individuals here and beyond to remain vigilant about your health. So to give you a little bit of my history, my mother passed away from breast cancer in 2010. And it's very clear and evident that that was a period of time that completely rocked my world and changed my life. And my mother at the time was only 55 when she passed away, so really young. She had an aggressive form of breast cancer. She was first diagnosed when she was 45, and she went into remission twice, and it came back the third time. And her oncologist had already told us that if it were to come back again after the second time, that it would more than likely be the last time. So my sensitivity was already heightened, that my risk was elevated. And I remember at the time living in Baltimore when my mother passed away, but I now live in Atlanta with my husband and my daughter. And when we first moved down here, I started going to a new OBGYN, and I shared with her my family history because my aunt as well had breast cancer, my mother's sister, but she is a survivor. So sharing my family history, of course, there's a ton of red flags. And my OBGYN was like, okay, well, we're definitely going to connect you with a breast specialist down here who happens to be a soror, Alpha Kappa Alpha Sorority Incorporated. And so she connected me with her. And I already knew at that point, I think I was about 36 years old, that I would be seeing her annually just to do a continuous check-in. And after I had my daughter, it was at my 3-month postpartum check-in, my OBGYN mentioned to me again about this genetic testing. And she had said it before, but prior to her saying it, it just wasn't in my wheelhouse. I have a very dear girlfriend who had BRCA1. She lost her mother her senior year in college. We were a year apart at the University of New Hampshire. And she passed away in 2013. And I remember her telling me when she got tested, and we had a really transparent conversation about it. I'm like, you know what, Jessica, I just don't know if that's for me. Like, what do I do with that information? Like, I already live in fear, right? Like at that point, I had already done lifestyle modifications. We had transitioned to eating more organic food, cutting out gluten, soy, and dairy, really trying to just holistically have as much possible control as we could. And I just didn't know how to deal with that information should I find out anything. And when my OBGYN brought it up to me, I was in the same space. I'm like, but then what, right? And at this point, that part of this diet, this, what's the word I'm looking for? That particular part of the entire breast cancer umbrella was very small, and not a ton of people knew about it. The only person at the time I had heard about it was Angelina Jolie, and nobody I knew had her on speed dial, right? So at my postpartum 3-month checkup, my OBGYN brought it up again. And I said, you know what? Why not? And at this point, they had advanced their services and I didn't have to go anywhere. I literally just had to go down the hallway and get the blood work done. So like, I didn't have an excuse. And I said, you know what, for nothing else, let me just, check to make sure for my daughter, make sure that, I'm in the clear and that, she's in the clear. And I genuinely, honestly believe that everything would come back in the clear. Like, I believe that my mother, her breast cancer was stress related. She battled with mental illness and depression and bipolar. There were a lot of other dynamics that were in play for her. And I just genuinely believe that it was not a genetic thing. And then the results came back, and I didn't have BRCA1. I didn't have BRCA2 because at the time, those were the 2 genetic mutations that were the most notable. I had a newer genetic mutation, called PALB2, PALB, the number 2. And at that point, this was back in 2016, March of 2016, they had just made the correlation, like within the last year, that there was an elevated risk. So with BRCA, your elevated risk of getting breast cancer versus somebody, a normal person, would be in the 80 percentile, right? For me, with the PALB2 in my family history, I had a 58% chance in my lifetime of getting breast cancer. I lost my mom in 2010. In 2016, I'm finding out this devastating news, and I have a 3-month-old daughter. And so I talked to my husband, and my husband is the calm to my cry. So I'm very animated, for y'all that don't know me. I'm very fun, lighthearted. I like to have fun. And, you know, I'm the pop-off queen in a good way. I'm always professional and keep it cute. But he's the one that keeps me calm, because I'm the one that's always like, you know, thinking about the next thing. And I'll never forget the moment that we had the conversation, and I just saw this look in his eyes. And he said to me, he's like, I would really hate that we had this information and we didn't do anything about it. Because for me, I wanted to wait. I'm like, okay, well, we know. What are the options? The options are you can do a prophylactic double mastectomy with reconstruction, or for the rest of your life, you get monitored 3 times a year, where you have to go in for an MRI, ultrasound, and your annual mammogram for the rest of your life. And I wanted to push it off. I'm like, well, okay, if we're going to do the surgery, and mind you, I just had a C-section. So somebody who had never been into the hospital for herself at all, I've never had to go to the ER, never had any issues, never had any surgeries, no broken bones. I had a C-section in November of 2015. In March of 2016, we're contemplating having another major surgery. And there's technically nothing wrong with me. I'm not sick. I don't have cancer. This is something that we're doing to be proactive. So my husband looked at me, he said, if I would hate to think that we waited and something happened, because the other side of that is every time I would go get a mammogram, there was something else. It was like the first time I got my baseline mammogram, everything was fine. The second time I got it, you know what? You should come back in. We just want to check something out. And I'm literally triggered every time because I'm reliving what my mother went through. And then there's the hurry up and wait game, right? Where and they always tell you on a Friday. So you have the whole weekend to just sit in it and just, you know, have your pity party. And so we'd elected in October of 2016 that I would go ahead and have this surgery. So my last mammogram was with my boobs, not my foobs. I don't have to do mammograms anymore, was in September of 2016. And I actually thought I had got out of it because I'm like, well, I'm about to have the surgery. Does it even matter? They're like, yeah, no, we actually do need to make sure that you're in the clear before we give you the surgery. I'm like, okay. So the last time I had a mammogram, this time it's like, okay, we got to pull you back in to do some additional looking. Oh, we want to do a lumpectomy. You got a funky looking lymph node. So there was just all this confirmation along the way that this is the right decision for you and your family. And I had what we call each other breasties, individuals who have gone through this dynamic together in some way, shape, or form, either before, after, or together. She gave me this crazy analogy that I hold dear to this day. She said, imagine getting on a plane. And as you're getting on the plane, the flight attendant says to you, there's a bomb on this plane. There's a 100% bomb on this plane. This bomb has a 58% chance of going off. Will you still get on the plane? That sealed it for me. I'm like, yeah, those odds are pretty tough. I think I'm going to just go ahead and do what I have to do. And, you know, for me, you know, nobody knows what the future holds. When having this surgery reduced my risk to underneath the, you know, general population. So it's nil to none, but you just never know, right? Like man plans, God laughs, but I genuinely just want my daughter and my family to know that I did everything in my power to fight to be here, right? With the cards that I was given, I felt like I was given an opportunity to take a little bit of control back of the crazy and not have to worry about the rabbit hole and not have to worry about the triggering and the trauma. And every time I have to go in for a checkup, I would do it again in a heartbeat. It wasn't an easy process. It was definitely a crazy process, but I would definitely, and I've told my surgeon and everybody else in between, like, if you have someone that wants to talk to me about it, I'm more than happy to give you the good, the bad, the ugly, everything in between. But I was very fortunate because of this organic, holistic lifestyle that we have been living, I really prepared my body for my surgery. And so I didn't have any complications. It was just, I had the drains like anybody else going through a mastectomy. I had the whole kit and caboodle. Actually, I had a pesky drain that wouldn't come out for like over a month, but that's neither here nor there. But when all was said and done, it looks like I had a breast augmentation, but anyone who's been through this journey knows that it was not a breast augmentation. There was much more to it. So my initial surgery was October 3rd, 2016. And then I elected to have a reconstruction because you can either have am I going too far down the rabbit hole?
No.
Okay. So, you can elect to either do a direct exchange where they do you have your breast surgeon that does the mastectomy, and then you have a plastic surgeon that comes in and either does a direct to implant or they put in what we call expanders. And so for me, at this point, I was 38 or something like that. I'm like, if this is going to be me for the rest of my life, I want to at least be confident with what I'm looking in the mirror. And so I elected to do the reconstruction. So when I woke up, I had expanders in, and, that image is, one of the trippiest things you can ever imagine. Like, you go to sleep and you wake up and what you look in the mirror does not look like what you remember. And so what they were doing was they would take those expanders and they would fill them with saline like every few weeks to create a pocket for the actual implant to go in. And my final exchange where I got the expanders out and got the implants put in was February 13th, 2017. And since then, all has been well. I actually have my annual checkup with my breast surgeon on next Wednesday. So now I just do my annual check-in. She does her ultrasound, we catch up, we ski-wee, we have a good time. But, again, you have to do what's best for you and you have to do what's best for your family. And I highly encourage anybody that has a family history, specifically a very close family history, to at least do the testing. Ignorance is not bliss. You just not, and honestly, for what I truly believe is that the reason why Black women have a higher mortality rate when it comes to breast cancer is because we are always the ones that do for everyone else before we do for ourselves, right? And we forget those annual appointments. And COVID definitely impacted that. 2020, all those annual doctor's appointments got canceled. You need to, if you haven't rescheduled them, you need to, because there are so many things that can just be caught earlier. And we just let things go like, oh, I'll deal with it later. And I feel like that's just something that is very inherent about the care and the love of a Black woman, that you have to look out for yourself. And if you have a family history of breast cancer, specifically as a Black woman, breast cancer within the Black community is more aggressive typically. And we're typically diagnosed at a younger age. And it's not just us now, like there's more and more people getting diagnosed younger. Like this whole 40 plus thing, that's not a thing anymore. You need to start checking your breasts way younger, right? So as soon as you have them, honestly, so that you genuinely know what's going on. But if you have a history, I highly encourage you to go after the genetic testing. If you have the close history, your insurance will cover it. They should cover it. And, from there, now you have an informed opportunity to make a decision for yourself and your family that will best fit you. Not everyone wants to do the surgery. I get it. But at least now you know that you need to be monitored more than you're currently being monitored. And if something were to happen, because there's 58%, but then there's the rest. I suck at math, 42%. There's a 42% chance that it might not happen. But at least now you're in a position to keep monitoring yourself to ensure that you're on top of anything that could happen. So that's my story, and I'm so happy that you reached out to me, Cara, because I've been very vigilant about breast cancer awareness. And just with the craziness of 2020, this was the first year where I didn't have anyone to talk to about it. I'm like, I share on my social media and stuff like that, but, I haven't had the opportunity to really share with the community about my story and how it could potentially help you know something that you didn't know. and genuinely help you, you know, make the best decision for you and your family.
And we already have comments on our Facebook Live of people thanking you for sharing.
Wow, thank you.
My pleasure.
There's so many comments on here. I'm going to read the comments in a little while, but I just wanted to ask a question, or I feel like I know this answer, but just to clarify. So you didn't have cancer, so you didn't have to get like radiation or chemo along with the surgery. It was just the mastectomy and then the reconstruction, right?
Yep. And that was the dynamic. It was like either go through this now or go through this highly potentially later with everything else, with the radiation and the chemo. And, you know, honestly, it was a no-brainer seeing everything that my mother went through 3 times. I didn't want that for my daughter. You know, it honestly wasn't even about me at that point. I always say my daughter saved my life, because had I not had her, I wouldn't have had the compulsion to take the test. I would have still just been kicking it down the road. And that's why I'm so vigilant about letting people know, like, don't do what I did. You don't need a huge catalyst in life to, you know, have you take this test. Just do it, because having the information is so much more powerful than not having it. And, you know, as helpless as we can feel because of breast cancer, this is something that can genuinely give you that, you know, at least that little bit of sense of control that there's something that I can do. And, you know, if nothing else, I ain't going down without a fight.
Absolutely. Right. Great. Thank you. Yes. Great. Thank you for sharing that.
My pleasure.
Yes.
That was amazing.
I'm going to read a few of the comments and questions, and anybody can jump in on here, because I'm not sure what order these are in. But here's one that says, one of our good girlfriends, Cece, she said, I got my mammogram in August, which was 2 years because of COVID. I usually go every year. And yes, Cara, it is very nerve-wracking. And before you got on, I was just saying that whether you've been diagnosed or not, having a mammogram every year, at least for me, is always nerve-wracking, waiting for the results to come in. So, you know, whether, you know, whatever, I'm always like, well, I'm just waiting for a good result. I don't want, you know, so that was her comment. And we have another comment that says, yes, my abnormal cells were classified as, I gotta put my glasses on. I think it says DCIS, abnormal cells in milk ducts, labeled as stage 0 breast cancer. So I think we were talking about that as well. And then Q's daughter said, how early should you get a mammogram? And we mentioned that earlier. I believe it is 10 years prior to, if your mother had breast cancer, it's 10 years prior to when they were diagnosed with breast cancer. Otherwise, I think the guideline is still 40, right? Yeah, but just to make a point on what Larissa was saying, I remember a few years ago, I had heard that in the state of Maryland, the youngest breast cancer patient was like a child. Like, I want to say maybe younger than 9. So yeah, it was young. I was like, what? So, you know, it's just, you know, you have to be vigilant. So, and then let's see, we've got another comment. My breast surgeon recommended genetic testing for BRCA breast cancer gene, and thankful my results came back negative. Those results determined the treatment of the abnormal cells found in my breast. I also tested negative for PALB2, which is that how you say it? PALB2?
Mm-hmm.
Okay, yep. Cece said, wow, Larissa, your story is informative and interesting. You are a strong person. Thanks for sharing. Yes, thank you, Larissa. Larissa, your story, this is another comment. Larissa, your story sounds similar to mine. I'm unable to make that difficult decision to have a bilateral mastectomy. Thanks for sharing. Another comment says, thanks for being so candid about your experience. I think they're talking to you, Larissa. So I think we have a lot of people that appreciate your story, as I knew they would, because I mean, it's it's an incredible story. So thank you for sharing that.
I'm just grateful to be able to share it. Like, I'm all about pay it forward. I'm here to let others know, if you hold on to it, what good does it do?
Sharing your story is one of sharing your story is one of those things. I think we've had conversations before about families not talking about medical history, not telling people, we've had this, we've had that, Yeah, I mean, we got to have the conversation. If you don't obviously know your mother had breast cancer, it could be somebody else. Like, what if you weren't as close to your aunt? That's another thing we got to do too. So thank you for sharing. And maybe some people listening and looking are going to be like, hey, let me just get some more family history from other people in my family,
Yeah. I think you raise a good point. In one of our sessions that we did this month, we had a group of young women, and this one young lady shared that her sister, I think Amira, we did the Saturday session, had breast cancer, and she didn't really have a lot of information. And my comment is that secrets are overrated, and that you really do need to share with family members. Because when you go to the doctor now, they ask about maternal parents, fraternal parents. They're scaling it all the way down to aunts and uncles and cousins. And so many times we get to a certain level and we have no clue. Sometimes we have no clue about a parent. We have no clue about an aunt or an uncle. And we really need to be open with sharing. And I understand that we're private. And when you get the cancer diagnosis, it can be a very devastating thing. It's a devastating piece of news. But at the same time, we have to try to work through the process of talking to family members so that they understand the history. I am a 22-year breast cancer survivor, and no one in my family has had breast cancer. So here I am, so when you talk about, oh, well, my mother had it and I should get tested, not my circumstance, not my grandmother, not my fraternal grandmother, not my maternal grandmother, not any cousins that I'm aware of, not first cousins, second cousins. So I'm the first. And I can say to my mother, she will tell me, no one else that we know has had breast cancer. So it's important that you share the information. When I found out I had breast cancer, I went into this mode of, let me gather all the information I can gather. And at some point, it's like, time out, Mark, stop gathering all the information, go be about your business. Because, I was at the point, let me talk to the radiologist, let me talk to the plastic surgeon, let me talk to and after a while, when I went to the last radiologist, it was a female, she said, listen, just go get this done. Stop talking to all the people. I was gathering all the information. I was doing all my research. I was getting all my data. And it's like, I had, they said I had breast cancer. So I'm going, oh, wait, what am I going to do? Am I going to do a lumpectomy? Am I going to do mastectomy? Am I going to have lymph nodes removed? Am I going to have breast removed? Am I going to, and she was going, really? I was on overload in terms of information because I work for a healthcare company. So I was gathering all this data. And after a while, you need to just dial it down a minute and just go be about your business of, what you need to do. So for me, I was over 40 when I was diagnosed, and I laugh. The joke for me is that I work for a healthcare company and we had a free mammogram for everybody over 40. And I'm like, I'm not getting on the van because people know I'm over 40. So those of you who know me, I'm like, I'm not, the Carly Simon song, You're So Vain. I'm like, I am not getting on the van. But I got on the van because I needed to get on the van. And they had an opening, and some things you remember very vividly. It was December of 98. And when they said, we see something, we're going to send it to your OB. And I'm never thinking, like, Cara, you said you think I wait for the results. I am never thinking that result is coming back anything other than negative. It's how I still roll today. Every time I get a mammogram, I'm like, this is just part of the process. So that's just where my headset is. And it was where my headset was then. So when you go for the test and when they tell you that you're positive, there is a moment. I had a 2-year-old, and the only thought that came to my mind was, I need to live for this 2-year-old. So Jeanette knows my 2-year-old, who is now 24 years old, okay? Who was one of her daughter's good friends. Amira knows all about my Marcus, okay? So my thought was, I need to live for this 2-year-old. And so you go, you know, and I also want to talk about women that have resources and women that don't have resources. And women that don't have resources and don't have healthcare coverage, we want to encourage them to really be advocates also, or to advocate for them. Because you don't have health coverage or you don't have a good job, we still want to encourage our sisters and brothers to forge ahead to get the services they need, to get screened, and know that there are resources out there for them as well. So when I went through the process, I opted for a lumpectomy. I had a phenomenal breast surgeon. I had lymph nodes removed. I went through the chemo. I went through radiation, and it was a 9-month process. But I will say that it was a process that everyone I encountered was phenomenal. From the chemo nurse who sticks you, you know, every month that you get stuck when you go through chemo, to the radiation folks who are in radiology, those things stick in your mind, because these folks who are on the front line and do what they do in the care is another level of blessings. It really is. Chemo nurses stick differently, I'm sorry, Amir, than an everyday nurse sticks or an assistant sticks. It's different. And you go through the motion. I was so very, very grateful that I had people in my corner. My mother was at the door almost every day when I was going through the process. I missed very little work, but it was because of my process that I went through. Is because of the providers that I had. I had a phenomenal oncologist. I was in a great system. I'm in Philly. I went through Penn. You know, it was a great system. I'm not going to say the experience was good, because going through breast cancer is not good on any level. However, I can say that coming through that process, because of the resources I had, just made it better for me, and made it, it just made it better. But at the same time, when you need to go get checked, you need to get checked. I always say we need to get our breasts pressed. Press those breasts, sisters. You know, men, get your breasts checked as well. You know, we need to stay on top of our healthcare coverage, whether we have insurance or not. We have to make the providers out there accountable for what, and we have to be our own advocates. We have to advocate for one another, and we have to advocate for ourselves. So that would be really my big thing to tell people to really. I was grateful that I worked for a healthcare, one of the top healthcare insurance in Philadelphia at the time. So I had resources. I talked to people, and folks are like, Marcia, enough already talking to people, you know, go handle your business and do what you need to do. And it worked for me, you know, until this day, all is well. So when I get my breasts, my mammograms every year, Cara, I go in there going, this is just, it's all good. I never go in there thinking anything other than this is all good. I don't say I'm waiting for the results. When I, you know, when I open the envelope, I'm going, yep. Because, you know, I don't think I should be any other way, because I've been that grateful and that blessed for that process. So I just tell women, just, you know, if you need to call somebody, take somebody with you, call somebody and take somebody with you. I will tell you, so let me say this. When I first found the lump, my parents and I have the same primary care physician. So out of all of the many years that I've ever gone to the doctor, the one day that I'm in the office, and my mother and I are in there the same day that I'm referred to the surgeon, my mother's in there with me. I'm going, why? Okay. You know, so when you talk about, is this really divine intervention? Like, why is she here? And she's just kind of appearing to be calm and patient. So I now have to explain to her that I have to go to the breast surgeon to get this the fine needle biopsy. And my mother is right there with me. And so then I take her with me to the plastic surgeon exam. That was not the place to take her, because I'm going, oh, I can get a tummy tuck and a boob job and I'm good. And my mother's looking at me like, really? And that's where my head was. And she's going, you really have, I'm like, so that wasn't the appointment to take her to. Because I'm kind of like, and you look at all these photos of the reconstruction, and I'm thinking, I'm gonna have new boobs and a tummy tuck, and it's all gonna be good. I can't do crunches, it's okay. So, but at the end of the day, I opted for the lumpectomy. It was the best choice for me. And I think, to Larissa's point, at the end of the day, when you put all your information together, you have to make the best choice for you. Each of our stories are going to be different. Whether you have another person who has the similar circumstances that Larissa has, or whether you have a person who goes through my circumstances of a lumpectomy and going through chemo and losing my hair. But I just had people that were in my corner. When my hair loss came in, one of my coworkers and I got up from my desk. We went into North Philadelphia to a wig store and got fitted for a wig at that moment. Because here was a woman that recognized, we need to do this for you. So people just came and just helped me and saved me and were just there for me. But you have to really step out on faith and make informed decisions and ask for help and get help from other people. Because what I will tell you, that while you feel like this journey you're taking alone, you cannot take the journey alone. You really cannot. So I hear, Larissa talk about, her family, and she went to her husband. You can't do this alone. And you really have to ask for help. If it doesn't come to you freely or automatically, you really have to reach out and ask for help. And it makes all the difference in the world. And I believe it's the reason that I am here today was because of the family and friends and colleagues, even at work. I would have people come up to me and, say, can I talk to you, man? Can I sing with you? Can I pray with you? And I'm going, sure, absolutely. I went through wigs and I went through baseball caps and I went through galas. I was wrapping my hair. I had, and depending on my outfit, I was working in corporate, so I was always dressed well. I had people stopping me in the street and speaking to me. One day I was dressed and I had a Muslim woman greeting me in the Muslim term because of how I was dressed in my gala and the wrap. So you just have to know that I think all will be well, and have faith and really have someone to walk with you through this process.
Great.
Marcy, I'm sorry. Can I just add one more comment because Marcy started off with something that I wanted to make sure that I spoke on in reference to Larissa's comment as well. When we talked when the young lady, it was actually two sisters. It was one above her and one, if she was in the middle. One sister had breast cancer that was older, one had breast cancer that was younger. And she said she didn't talk to them because they were private. And I'm like, you got to find a way to talk to your sisters because you're right in the middle. Like, split that down in half. You got 50% chance of having breast cancer. And like in the Black community, unfortunately, cancer in general is like taboo. We do not talk about it. Somebody will more openly talk about somebody getting killed by gun violence before they say somebody died from a preventable illness. And I don't know why that is, but like, we need to break those generational taboo stories, these urban legends. We have to stop this. Like, we have to talk about it and tell about it.
I agree, Amira, absolutely. One of our colleagues that works with us who has a brother, and she didn't even know her brother had cancer until he was at the stage where he was dying. And they had no clue because he, what is the shame of, it's not like you went out and did this to yourself. I have no idea where, Larissa, you went through this with your mom and you're going, like, where did this come from? Like I said, I was the first one in my family. No one else has had this. No one else that we know of as far back as we know, so you have to talk about it. You have to share the information. We're talking about saving lives. We're talking about saving lives, saving lives of our people, saving lives of people of color, folks who are, you know, our disadvantaged, the communities that Amira and I work in. We are trying to educate folks just to get screened. And to know that it's okay to get screened, it's okay to get tested, and to educate them about clinical trials, talk about clinical trials. You know, we've heard more about, listen, COVID has done a lot of negative things, it's done some positive. Have we heard clinical trials more with the pandemic than ever, at least for me? You know, helping people to understand what a clinical trial is. And if we as people of color don't participate in clinical trials, then we will not be the benefit of what clinical trials can do for us as a people.
Yeah. But I also think too, to Amira's point, the one thing that you said about cancer being a preventable, right? It doesn't mean it's a death sentence. And I think that in our community, one of the reasons that it may be taboo and people may not want to discuss it is because as soon as someone says, I have cancer, then, you know, folks are automatically assuming that, you know, it's a death sentence. And, you know, no one wants to face that, right? So I think that knowing and hearing that it's preventable, like keep saying that this is preventable, it's curable, it's treatable if it's caught early. Like if that's the message and that's the narrative that, you know, we are promoting, then more folks will begin to do those things to make sure that it's preventable or treatable. So that's important. I'm happy to hear you say, you know, I was happy to hear you say that, preventable.
Mm-hmm. I also want to, you brought up a good point. I don't remember who said it. It was probably Marcy, but I, you know, am blessed with insurance, but a lot of people aren't. And I'm hopeful that someone on watching us will share some resources that they may know where people can get free mammograms. I know that Alpha Kappa Alpha Sorority Incorporated has a mammogram truck that's traveling around the country, but I'm sure that every state has some free resources to provide mammograms to women. And I would love if anyone knows any to share them in our Facebook Live as well, because, you know, even with my own insurance, as I mentioned, at one point, they were only offering mammograms every couple of years. And I went on and paid for the years that they weren't paying for it. I was able to do that. But, you know, we have to find these resources and not have any excuse why you can't have the necessary services that you need. So if anyone's out there listening and you know some resources, no matter what state or area you're in, please share them to bless someone else who may need them. So
you can also look on Susan G. Coleman's website. She has a lot of resources for breast cancer, specifically breast cancer, because that's all, you know, Susan G. is all about breast cancer. So her website is a good place. And looking for those mammogram trucks, like people who are sponsoring the mammogram trucks, you can look, you can Google that as well.
And I will also just say one more thing. I'm so thankful to Larissa's testimony, because I also lost an aunt to breast cancer. I was much younger, but my mother shares the story with me that my aunt didn't want to have a mastectomy because she felt like she would be less of a woman. And so this was years ago. I was a little girl, so we're talking about 40 something years ago. So the bravery of, you know, of your story, and other stories like you, that women are now brave enough to share, and we're defining beauty for ourselves, right? That's powerful and very important. So she was, you know, at that time, though, her breasts were more important than her health, because of the, you know, the image at that time of society and what beauty, how we define beauty at that time for women. So just beauty is health. Mm-hmm. Right. And so to be able to hear your story is amazing.
And Jeanette, you bring up a really great point, because the way the advancements that have happened over the years, just even since I went through my surgery, and the things that the surgeons are able to do to really try to create a sense of normalcy for their patients. Like you could, if you had to have your nipples removed, there's like tattoo artists that can create like what looks like a nipple, like it's like a 3D tattoo. You don't it because all those nerves are gone. So, I mean, there are ways that you can still have that, self-confidence and still do what you have to do for yourself, right? And make sure that you're here to look in the mirror, right? And so I totally empathize with that thought process of, especially Black women, our hair, put into our hair, our bodies, like it's so very important. And I can totally get why that would be an issue. But in this day and age, from an aesthetic stance, there are just so many advancements that are possible now that really shouldn't even come into your thought process. Yes, it's going to be a process. Yes, you're going to go through some things and you're going to have to heal. But what you're looking at in the mirror isn't what was happening 40 years ago. It's advanced by so much. And you really can find that sense of normalcy, knowing that you've also, beat this thing, right? Whether it's proactively or you're in the fight right now, like there's things that you can do to ensure that you look in the mirror and you still feel really good about yourself, right? But at the end of the day, like Miss Marcy said, it's about being here. It's about saving lives. It's about looking in the mirror, period.
Mm-hmm. I actually went to, I'm sorry. Go ahead. I actually went to nursing school with a nurse who does the tattoos. But I also wanted to comment on Jeanette's point in reference to Black people not liking a pity party. Like I know for me, a lot of things that I don't talk about is because I hate for people to feel sorry for me. I don't want people to be, oh no, she has this going on. We gotta help her. So I get it. And, we always want to be Black and proud. Like we don't want people to feel sorry for us. So I know that goes along with the taboo, but we need to break those stigmas. We got to stop it.
Right. Yep. Absolutely.
I just had a funny about the vein part when Marcia was talking about, going to go get the wig. What we're doing now, we cutting our hair off anyway. So.
Right. And that's the other thing, because, for as Black women, hair, like, our crown. Our crown is, for those, if you've known me long or known me short, the transitions are great, whether it's short or long or color or wig. So the thought of, I went and got wigs and found a good girlfriend in Soror who was a hairdresser at the time, and, helped trim a wig, similar to the hair, because I was still working in corporate and I was still trying to be the diva and the heels and still trying to do my thing. So those things are important. And then when you get all the way to bald, it is a process and it's a transformation. But what I do know for certain is that, trouble don't last always, and this too shall pass. And you do come through. You absolutely do come through. And if you share it with other people, you will find that there are people there who want to help you and help you come through and get through the process. And we just have to get to that point. When that girlfriend got me up at lunch and took me to the plaza in North Philadelphia to a wig store, and we happened into another Black woman who was in there, helped me select the wig and trim it out. So you don't know what really God has for you and how he's just really going to work it all out. Mm-hmm.
He always works it out.
He does. Any questions out there in Facebook land, Cara?
Yeah, we do have some questions, and we had a comment for you, Marcy. This is from our good girlfriend, Cece. She said, Marcia, I didn't know. Wow, that was God for her to be there. She's talking about your mom being at the doctor's appointment with you. And she said, thanks for sharing. You carry it well. And then she had a question. I think this is for both you and Larissa. She said, how do you all deal with the stress of it all?
Prayer, therapy, and wine.
All of the above, all together.
I can only be my authentic self. Prayer first, always. Therapy. Just talked to my therapist yesterday.
Absolutely. Yeah. I have been very fortunate and very blessed to always have good people in my life. I have a great family. I have wonderful girlfriends who have been with me for life. I have a village crew who I didn't have initially early on because my son was 2. So I had just really, I would say the village was sort of just beginning to form. I have some sorority sisters who just, the doorbell rings and they showed up.
Recording in progress.
As friends do. They literally just were there. And, it almost becomes surreal because, you just turn around and, folks are just there for you. So I would say don't count out the people that are around you, that are really there for you, but certainly the wine helps. I like you, Larissa. I checked you out, sister.
Listen, y'all know I'm usually
together. Larissa, another time we have to bring Larissa back.
When I saw her do it, I was
like, this whole time. I was like, don't take a sip.
Larissa, we got to come back and talk about some wine.
No, Larissa, actually, Larissa's going to talk about the wine as our guest business a little later. I didn't even share that part with you.
Listen,
all.
You didn't have to. I checked her out. I'm going, oh yes.
She might have to do a part 2.
I was trying to keep it cute this whole time. I'm like, nobody else is having a glass.
No, I kind of went on camera, but sometimes I do it on camera.
Yeah.
I'm drinking a little water. I gave up wine for like a couple of weeks because I just needed to, to dial it
Everybody
down.
Needs a break. Everybody needs a break.
It's interesting. I actually have my race for the cure.
Larissa, you just didn't see their glasses. They all have their wine there. So.
Larissa, did I hear you say that your mom had battled with mental illness as well?
Yes. Wow. And it was really weird for me because I believe it was the mental illness kicked first, right? So it was February of 2010 when 2000 when she was first diagnosed with depression, and then breast cancer came in May. So it's kind of easy to make that correlation, like, oh, okay. And so it was honestly for the last 9 years of her life, it was, which one are we battling? Which one are we dealing with? Where are we going to get to this normalcy? And for my mom, I finally got her back. Like I saw my mom again, like the woman that raised me, I saw her again. And that's when the breast cancer came back. And I think that's what made it even more devastating. It was like, because for a period of time, I didn't know who she was. I just knew I loved her because she was my mom and that this wasn't her fault. None of it was her fault.
Right.
And so, those were just the cards that we were dealt. And she was always just so brave and strong, no matter what she was dealing with. But it was very easy for me to kind of rest in this is probably just a direct correlation, because again, at the time, there wasn't any real history with breast cancer that we knew of in the family. My aunt was diagnosed later on in life after my mother passed away, and she got tested and she didn't have the genetics. She doesn't have PALB2. So it's really, information is power, right? And go ahead.
I have an aunt by marriage that 7-time survivor. Unfortunately, right now, though, she's in hospice, but she fought back every time. Like, you coming at me? Okay, I'm coming for you. And that's how she carries life too. She's like, that aunt is the feisty one. And she's in her 70s. So I'm saying that she handled it well.
Second Timothy, oh gosh, why is the verse 4:7? I fought the good fight. I finished the race. I kept the faith.
Yep.
And that was the verse that it took a minute. Took a very long minute. It took about a year and change, and your aunt's still here. So, we can completely celebrate her fight that is still in her.
Right.
But, she's fighting the good fight, and she has kept the faith, and she'll finish her race when she's ready.
Oh, believe me. This one? She's going to say, I'm not ready yet. Okay,
on her terms. And that's what really shows you the testament of the human spirit. So I'll share with you my mother's last days. We knew in January of 2010 that the breast cancer has spread to her brain, and it was causing her to lose cognitive function. And so the doctor at the time gave her 3 to 6 months, and then it dropped to weeks. And we decided as a family, because I'm an only child. And so my parents lived in Albany, New York. At the time, I was living in Baltimore. we decided as a family that my mother would be better off with my aunt and uncle, her sister and husband, because they were both retired and they live in Warner Robins, Georgia. And my dad was doing the best that he could, but he just wasn't in a position to give her the round the clock care that she needed. So they drove from Albany, New York to Warner Robins. And one of her last wishes was to see my grandmother, who was my dad's mom, in Jamaica. And we couldn't get her on the plane because the doctors wouldn't clear her. We had to get on a ship. So we went on a Royal Caribbean ship and we went to Haiti, Labadee, Haiti, and we went to Jamaica, and we got to spend about maybe 3-ish hours with my grandmother. Got back on the boat, came back to Miami, drove back up to Warner Robins, and that was on a Thursday. She passed the following Wednesday. So in the midst of my, despair and grief, like, I know that she did exactly what she wanted to do. And that sounds just like the spirit of your auntie. And, the beautiful thing about, what we mourn is, I have a very dear friend who says, grief is the evidence of love, right? And so the fact that we grieve is that because we loved, and, that's the gift. And of course it doesn't hurt when you're in it, but, there's still so much to celebrate. And, just letting her know, like, you always been that feisty, inspiring auntie for me. And I, there's just so much to still love on her. And I'm, happy that you still have that time to be able to share that with her, for sure. I'm going to take a sip.
Thank you.
We have a lot of comments, and they keep coming in talking about these are powerful narratives and people thanking you all for sharing your testimony. So just know that you are blessing a lot of people this evening.
Right.
And more to come on this as people are still logging in. But one thing I see that we've had a couple of men log in as well, just to check us out. And one thing I just want to ask is, so are men's breast exams the same as women's? Like, do they do the same self-monthly exams? I don't know any of that. Like, how'd your father find out he had breast cancer, Jeanette? Do you know?
So it's funny that you ask that. He went for just a regular physical, and the doctor felt a lump in his breast. So the doctor, I guess that's, part of, you think of breast exams just being for women. And I'm saying it's funny, meaning like unique or peculiar, because we didn't make a big deal of it. You know what I mean? He went through, I think he had radiation too, but it was not a big deal at all. It was discussed. My mother talked about it. There was no fear of him dying of breast cancer. In fact, that's not what he died of. So he was a breast cancer survivor, but we didn't talk about it. Like, I'm sure if I have cousins or relatives that are watching tonight, this is probably the first time that they're hearing about it too.
So I just thought about something. So if your father has breast cancer, does that affect the likelihood of a daughter having it, a son having it, or is it only if your mother has breast cancer? Like, how? I wonder. I'm just asking questions. I'm not saying, like we said before.
Yeah.
Good question.
That's a great question.
Like, how that works.
I really don't know, though. I don't, like, as a nurse and as somebody who, who's taught about cancer multiple times to students and to the layperson, I don't think there's enough studies and enough research out there to know, like, what the I know that the statistics are a lot lower for men, but because of the statistics and because of the lack of research, there's no like standard and there's no like screenings for men. And for women, I know that our breast exams are around our menstrual cycle because the tissue changes, but men don't have that. So it's more about that same narrative of know what's normal for you, know what your body looks like. So look at your body regularly to see if there's something different. And even when it comes down to the composition of their breast tissue is different. They don't have the ducts and the little lobes that we have that creates the milk to prepare for a baby. They don't have that. So it's one of those things where cancer can grow anywhere. And for men, it just so happens to grow in the breast tissue. Yeah. So I wish I had more answers in reference to that, but we just don't know.
I was going to say, that a homework assignment?
No, that's an answer though. That's a good answer. I mean, I think you gave good, valuable information there saying that, you know, they have to know their own bodies and they need to be proactive in that sense. So interesting. Wow. Wow. That was a lot. That was very powerful and it was a whole lot. I'm just going to check and see if we have any more comments before we no, I think we've covered all of the comments. Anyone else have anything they want to share?
Get those mammograms.
Yes, get your mammogram.
Get checked.
I'm going to make my appointment tomorrow and check in with my good girlfriends and let y'all know I did it. Yeah. And then actually go.
Okay, there you go.
I'm due for
and check your breast every month in the interim. Every month, check your breast.
I'm all about that.
Yes.
Thank you. Amira, any comments you'd like to leave us from the nurse in you?
Well, I'm trying to remember without looking at the PowerPoint slide with that last slide that Dr. Jamont, what is it? Hold on, I gotta pull it up. Sisters, get screened, do it for you, do it for your family. Remember, early detection saves lives, and let's conquer cancer together.
Yep, that's it.
It's a great way to end that part of our discussion. So thank you so much, Amira, for that. And now, now we move into the part of our discussion where we highlight an African-American female-owned business. And honestly, Amira, if you have something that you'd like to share, please share that as well. But we are going to start with Larissa sharing her business initiatives. So anything you want to share with us at this point, Larissa? And like I said, it may be you have to come back for a part 2, but you can at least introduce us to what you're working with and some of your initiatives tonight.
Yeah, happy to. So I work in the wine industry. And so I have figured out the dialogue with my daughter. So when she goes to school, she doesn't just tell her friends that mommy drinks wine and loves wine, because that just doesn't go over well. People show up at your door asking questions. So that mommy educates people about wine. So I've been in the wine industry now on the wholesale side for, going on maybe 12 years now. And I work on what we call the supplier side of the business. So you have the people that make the wine, which is the supplier, you have the distributor, and then you have the customers, whether they're retail or what we would consider on-premise restaurants, hotels, lounges, clubs, where you consume your alcoholic beverages on premises. That's the 3-tier system. So I've been in this industry now for 12 years almost. And what I realized, specifically when I got into wine and really started diving into wine education, is that I really got tired of just being the only one in the room. I would look around the room and it would just be me. And, I'm used to it. It's always kind of been the way with my, career path. I was in pharmaceutical sales, in college. I went to a very, very, very public white institution, University of New Hampshire, where Black people didn't make 1%. So I've been in these rooms pretty much all my life, but I knew pretty early on with wine that there was something that we were missing as a people. I found power in wine knowledge. I've seen it 1,000 times at fine dining restaurants where the host or the hostess they get the wine list and they literally will take the wine list and give it to somebody else at the table who they feel is more well-versed in wine. And in doing that, they give away their budget, they give away a piece of their power. And honestly, we as Black people just aren't expected to know about wine because most of us didn't grow up with wine on our table. And I wanted to do something about it. So my passion project is called The Lotus and the Vines. And essentially what I do is it's pivoted significantly to virtual tastings now. So you can literally touch almost anyone in the world through Zoom and through Facebook and through all these other different social media platforms. So I offer virtual tastings where I always say wine is my passport. If you really think about it, wine is one of the few things that you can have where you can go almost anywhere in the world. France, Spain, Italy, South Africa, Chile, Argentina, Australia, wherever you want, where fine wine grapes are grown, and you're going there through a bottle of wine. And it maybe cost you $15. And you're getting that authentic expression of a region and of a culture and of their history. And if you think about these crazy times that we thought we were coming out of, but they're still kind of lingering, and we can't travel the way that we used to, what better way to travel than through wine? So I create these unique experiences based on what people are wanting to do for their time. And it's been really cool. I've connected with people all over the country, and it's been a good time. So my social media platform is at Lotus, like the flower, Vine, like the grapevine, wine. And Instagram is the main social media platform that I use, but the name, The Lotus and the Vines, is inspired by my mother. So I wrote a book in 2012 after my mother passed called The Lotus Files. And that was me turning my blog at the time that chronicled that first year after losing her, because I thought I was losing my everlasting mind. And I never found an account of somebody else going through it. Out of all the grief books that I read, I converted my blog into a book and I called it The Lotus Files. And it really just walked through that first year without her and how those who have lost someone that's very important to them and those who haven't, but are supporting someone who's lost someone, how you can help somebody in a very authentic and transparent way. So I continued that realm with The Lotus and the Vines. So the lotus travels through dark and murky waters to bloom into a beautiful flower on top of that water. And that's how I've always envisioned my mother's journey and my journey finding my light again after losing her. So there's always that lotus component in my story. But yeah, I'm around, I'm here. The holidays are coming. I know, it looks like the numbers are starting to get better. I've always said, hopefully the train at the end of the tunnel, the light at the end of the tunnel isn't a train. We're not always sure about that. Looks like it's a train, but looks like it's starting to go away. But if that's something that you all are interested in doing with your friends, family, there's lots of different ways we can curate a very cool experience for you.
I love it.
I am definitely a fancy wino. Almost a sommelier, but not professionally, whatever. I belong to like 3-4 clubs. I just texted my husband to tell him, bring me one of the bottles from, we just tried some new wine from the country of Georgia, which is where wine originated. So I'm a little bit more than the average. And when somebody tells me, oh, we've got some Moscato, that's not wine. Go somewhere with that. That is
if it comes from the northern Italy, Piedmont region where it originated, that's really, really good made Moscato. However, I agree with you.
They didn't bring it here that way.
No, they did not bring it here that way. But yeah, so there's so many different facets of it. Like if you love sweet wine, because that's how we all got into wine for the most part, is we started with something sweet and then we evolve. You kind of, grow your palate but you start sweet. And then if you want to learn more, you can. If you want to stay sweet, guess what? I have so many other wines you can try besides Moscato that are sweet wines that'll make your palate happy. And you can still travel the world and everyone feels good. And you are where you are. And I'm just here to help you elevate your experience. Like there's so much more than I try my best not to throw name brands out there.
I'm going to be reaching out to you. I will be calling you.
Absolutely.
Remember, I'm one of the good girlfriends.
I'm ready. I love my good girlfriends. We go together now.
That's right. Yes, we do.
We had a comment, and we will put this in the Facebook Live comments as well. But we had a question. Can you give the website again? The Lotus and the Vines.
Yeah. So my website is www.thelotusandthevines.com. And then my social media on Facebook, Instagram, Twitter is all Lotus Vine Wine.
Got it. We'll add that into the Facebook Live as well. So what about the book? Is the book still available?
It is available on Amazon, Kindle and paperback. It sure is. Okay. I think it's like only $2.99 on Kindle. Normally during the holidays, I will just gift it to people. The point of the book was to raise money for a scholarship in my mom's honor, which we did. We were commissioned to raise $20,000 within 5 years at her college alma mater to create a scholarship that would live in perpetuity. And the proceeds of the scholarship annually either go to a survivor or the kin of a shero who's passed on. Or if there's nobody that qualifies in that space, then someone that's from her major that, distributes merit and all of those things. And she was management of human resources. This was Roberts Weston College in Rochester, New York. So once we raised the money for the scholarship, there was not just the book, there were other things that went into raising the money. At this point, I just wanted to keep my mother's legacy of helping people alive. And so during the holidays, I'll gift the Kindle version, just because the holidays are always the toughest part, especially the first year after losing someone very dear. But yeah, it's available on Kindle. So if you want to gift it to somebody, if you want it for yourself, it's a very quick read. It's emotional. I got cussed out a few times, like, you ain't telling me I was gonna be crying. But again, it's raw, it's authentic, it's where I was at the time. And it was, for me, a way to get out what I was feeling. And ultimately it turned into something much better where I could help somebody else out along the way.
Awesome. Well, thank you. Thank you, ladies. This was awesome. Oh my goodness.
I actually do have a business. My business, my business is on hold right now, so I kind of feel like I'm gonna share because eventually it will be open back up. But I will share a little bit of background to my story and Marcy, I don't even think you know this, so it's all story time for you. So as growing up in Philly as a Black woman, very poor and not really having a lot of people around me that went to college, I didn't feel like college was an option for me. So I opted for a career, a vocational career. Nothing wrong with vocations. Where I got started, but I knew I was going to be in healthcare. I didn't know I was going to be a nurse, but I knew I was going to be in healthcare. So right out of high school, I went to vocational school and became a medical assistant. And I was a medical assistant for a really long time. And eventually I started working for the city of Philadelphia in the public health districts. And I remember talking to one of the directors of the health center, and she said, why are you not going back to school? You do more than the nurses, more than the nurses, you have a lot of skill. And I was like, well, I don't have any money. I don't know what to do. So she, a white woman, and I know that has nothing to do, probably very little to do with my success, but it was somebody outside of me that saw something in me that I didn't see in myself and paved the way for me pave the road that I didn't know existed. So she helped me apply for financial aid. She helped me get into community college, which at the time was like one of the second best nursing schools in the country, because this was back in the early 2000s. And it was really hard to get into community college, even though it was a community college. Specifically, their nursing program was one of the best. So it was really hard to get in there, if you can imagine getting into a community college nursing program. So I was honored to get in there. And when I got in there, and this is how sometimes doors open for you that you don't know is supposed to be open for you, because what happened when I got there was kind of nothing short of a miracle. But when I got there, because I was so well versed in healthcare already, because I was a medical assistant for a long time, I was watched by the administrators of the program, and they had this scholarship it was called IMPART, Improving Minority Access to Research Tracks. And the intention was to show people, and it was this woman over at Jefferson. she wrote a grant, and it was like a $250,000 grant to show people that if African Americans had doors intentionally opened for them, then they'll be as successful, if not more successful, as white people who have, their lives basically paid for them when they're born. So in that program, while at community college, I got a scholarship to get some bachelor's credits and some master's credits while at community college at an associate's degree level. And then because I was an MPART, I was eligible to apply for a scholarship from the Independence Foundation, who paid for, which two or three of us, I can't remember at the time, 3 of us were eligible out of the 8 of us that were in MPART. And I was one of the ones that got my bachelor's degree paid for. And then eventually my master's degree, I never paid for school. If you're following me, I haven't paid for school. The scholarship, the PhD that I'm going for, I'm not paying for that either. But when I was in my program, I thought if I ever got the opportunity, I would help other people the same way that I was helped when I was, in this program in his job as a medical assistant. So I started a nonprofit organization called the Cultural Institute of Health and Education. And that program, the program that I had, because I plan to expand once it's open again, because the pandemic and me going back to school kind of like put it on hold. But it's for a patient care tech. And what a patient care tech is a medical assistant and nursing assistant together. And in my program, they can get training for both, but they get the certification for like 3 different things. So they can work in a hospital, a doctor's office, dialysis, they can be teletext. And because I got funded, like we applied for funding for my organization, I was fully funded so that I could pay people to teach. The individuals that I have in my program don't have to pay. So, and if you had to pay for it, it would be $15,000 to $20,000 to get this certification. And not only did we train them, we also certified them. So, and then the certification was good throughout the entire country. So even though you went to school with us and you decided to move somewhere else in the country, the certification was good throughout the country. So that's my business. It is a vocational program for the underprivileged and underserved in Philadelphia. And that's how I got into I had served some people were aging out of foster care. That's how that became my topic for my PhD. But yes, I do have a business. And I actually have 2 books on Amazon. You have to search Amira Clemens on Amazon. And, I have books on it because I wanted to have some books to help me with, fund this, because I never wanted anybody to have to pay to go to my program. I always wanted it to be free. And hopefully it can stay free forever.
That is incredible, Amira. I was trying to take notes. You said it's the Cultural Institute of Health and Education?
Yes, CIHE. We call it CIHE for short. The Cultural Institute of Health and Education, yes.
Okay, I'm going to add that into our Facebook Live. That is amazing.
That is awesome.
Oh my goodness.
And awesome that you're not paying for school. Like,
right.
You need to be some classes on that stuff too.
Right. Yeah.
I feel like I do want to teach people that because, I don't know. I feel like it's like the grace of God and like always being in the right place at the right time and always keeping an open mind when people, come to you and say, what do you think about this? Or what, because sometimes when we're in college, we just shut down. We just want to go to class. We don't want to hear about this extra stuff. We don't want to write an essay. We just want to go to class. But, just keep an open mind and always. And I actually put that in my book because one of my books is for nursing students. I wrote it with nursing students in mind. Like if you want to successfully get through nursing school, this is what I did. And this is what I used to tell my students. And one of the chapters was on that, like keeping an open mind, like don't close your mind to things because that's how doors close. So.
Love that message. Love it. Oh my gosh. Wow. That's awesome. Thank you so much for sharing that. I mean, that right there is going to bless someone. Just the opportunity alone. You said what'd you say it was? A patient care tech is a combination of a medical assistant and what other type of assistant?
Nursing assistant.
Nursing assistant.
So they can either work in a hospital or work in outpatient. They can work, usually it's one or the other. Mm-hmm. But this one was a combination. But the certificate, because I certified myself just so I could, you know, go through the grueling process. The exam, the way the exam is, you can work as a dialysis technician and also a teletech with the certification as well, and a phlebotomist. Sorry, phlebotomist. So it's like an umbrella certification, but we teach all of that in the program
for free.
For free.
Awesome.
Mm-hmm.
Wow. Anyone else have anything they need to share that you haven't told us about? Because this is powerful right here. That was amazing. No? Okay. Well, for our guests, we have an after show. So when we get off of the Facebook Live, don't hang up yet. We want to thank you personally real quick. But
right, because that after that wine, we're certainly gonna need some health care, right?
And we had a last comment from our good girlfriend Cece, and I'm too vain to put on my glasses, so I'm gonna read this as best I can. It says, my sister did similar for her PhD program, writing essays, got her grants that she paid little to nothing.
Mm-hmm.
So yeah, we like that.
So that goes to show there's resources out there for many, many things. And we just really need to be about looking for those resources and just asking for help and not being afraid to ask other people, other sister friends who are around us for help.
And also, if we know about the information, share it.
Share it, yes.
Right.
Sharing this information. Yes. Please share our Facebook Live. Please share our YouTube channel. We have so many great conversations on YouTube. Please go out there to the Good Girlfriends page and share, because I'm telling you, I know I say this every time we're on. I am thoroughly blessed every time we have one of these conversations. And I mean, it's powerful information in all of this. So keep sharing the information, everyone. And don't forget to do your breast exams monthly. Don't forget to get yourself. And men, check yourselves as well. So with that, we're going to say good night and thank you. And we hope that everyone will join us in 2 more weeks, not next Thursday, but the following Thursday. And I honestly can't remember what our conversation is going to be about, but just stay tuned. It's going to be a good one. So we'll see you then.
Happy Friday Eve.
Yes.
Happy you guys.
Thank you all. And we are going to end right